Good afternoon, everyone. It's so nice to see so many scholars here today. We are going to jump right into today's session. Thank you so much for coming. I am going to ask that each of you turn your videos on if possible. We would really appreciate it. We want to see your lovely faces today. I'm going to give you all a second to do that. And in the meantime, I'm going to go ahead and introduce myself. My name is Devanya Porter. I am the manager of education programs here at the Economic Club of Washington. And I'm going to go ahead and pass it over to Brenda to introduce herself and then to Victoria.
Good afternoon, everyone. My name is Brenda, and I am the new associate for the education programs team. And I'm really excited to be working with you all this year.
And hello, I'm Victoria Dunn. I'm the director of the education program, and I've been working on a lot on our internship program, and I've seen a lot of your faces or seen a lot of your emails via email, and I've seen a lot of your names via email, but it's good to see your face. And I hope that you all will join via video if you're able.
Thank you for that. And before I introduce Kelly, I just want to give all the scholars an opportunity to understand what we're doing here today. So this is an opportunity for you to learn more about the healthcare industry and ask Kelly all the questions that you have. We definitely want you to feel comfortable utilizing the chat. So if you can go ahead and introduce yourselves via the chat box will be fine. You can share your name, what year you got the scholarship, and maybe the school that you attend now. If you are a graduate, please let us know. We would love to hear about that as well. So welcome, everyone. I'm not seeing anything in the chat yet. Team, if you see something, let me know. Looks like a few of them are typing. Welcome, Sierra. Welcome, Nadine and Betty. And Arabia. Thank you so much for participating and sharing. I'm not going to call you all out and share your information. I'm just going to let you all connect via the chat. But I'm going to go ahead and introduce Kelly. So Kelly, she grew up in Farmland, Minnesota, and she attended Hastings High School. She also attended the Catholic University Nursing School, and then she worked 10 years in the nursing department as an ICU nurse and in the ER department as well. She graduated from Georgetown University, and then she became an independent nurse practitioner in 2009, and now she continues to serve at her own practice, and she has two wonderful children who are also in college, and she really enjoys caring for people. So without further ado, we're going to just take a moment and give Kelly an opportunity to speak with you all about her profession.
All right. Hi, everyone. Thank you for joining today. I'm very excited about this opportunity and really to share my story about how I got here. As Devanya said, I grew up in Minnesota in the farmland, really. I grew up on a dairy farm in the southern part of Minnesota where I really watched my mom, who was a nurse as well, take care of people in a very rural area. And I remember her putting me on the bus at a very young age with her nursing cap, and her nursing cape. We walked to the bus and she would tell me all the stories about the people that she took care of. And I can remember from the age of 5 of wanting to be just like her. And here I am. I'm very proud of it. And she was really somebody who I looked up to, and I still do. She's 80, and my mom still works 3 days a week as a nurse. So it's really cool to see her still loving what she does and sharing our passion together. It's really cool. So my story really, it started back then, but to become an independent nurse practitioner, I own 3 medical practices and a skin company. And that really started in 2008 when there was a big shift in the medical industry in this country. And we really saw it here in Washington, D.C. So in 2008, big commodity medicine came in and really took over hospitals. MedStar, Adventist, Johns Hopkins took over Sibley and Suburban Hospital in this area. And I, at the time, happened to be working at Sibley Hospital in the emergency department as a nurse practitioner. I graduated in 2006 from Georgetown. And it was interesting because when you discharged people back then from the emergency department, you always had to say, who is your primary care doctor? Who are you going to be following up with? And all of a sudden in 2008, patients started saying, well, I don't have a primary care doctor anymore. My doctor went concierge or MD VIP. It was the shift that was happening. And a lot of patients lost their primary care providers because their doctors were going concierge medicine and they couldn't afford it. And I remember one night I was taking care of this little lady. She had to be 87 and she had these pink nails, and she looked at me and she was like, I don't have a primary care. He did go concierge and I can't afford to see him. And she said, well, why can't you take care of me? I said, well, I don't have a place to take care of you, and I was kind of really got me thinking on a bigger level. And then 2 weeks later, the contract who had the contract for the emergency department, it was called NES. It was this big company. They lost the contract and I lost my job. So that was the moment when everything kind of shifted for me. And I thought, you know what, I'm going to do this. I'm going to hang my shingle in Spring Valley, DC, and I am going to open a business that is focused on community health and taking care of insured people. And here I am, that was in 2009. Here we are 12 years later. We have over 42,000 patients. We have 18 providers, all nurse practitioners. And it's really been an amazing ride to get here. But I love what I do. I love taking care of people. I think even bigger than that, I love helping other people figure out where they want to be in medicine, because medicine is a place that you will always have a job. You will always have flexibility, especially female or male, but for females, to work weekends, to work nights, you have kids, you can go back to school. And this profession just offers so many avenues for success, if you ask me. And I love it. Love my job, love coming to work. And I would never say it's even work for me, because I just love that relationship that I have with my patients, even my staff. So I'm here to help. I'm excited to be here and really, support. And if anybody has any question, I could probably answer it, even if you're not interested in nursing, right? If you want to be a PA or you want to be in the lab or you want to go to medical school, ask away. I'm here to support and help.
I have a question. I'm Destiny.
Go ahead, Destiny.
Hi, Destiny. Nice to meet
So
you.
nice to meet you. So, how does the medical field differ from I hope this isn't new, but from in the beginning when you were just starting out to now post COVID? How is it different?
Sure. Well, I think, back when I first started, when I became a nurse in 1996, nurse practitioners didn't have a lot of autonomy. And right now, over the years, nurse practitioners have gained a lot of independence, autonomy, and there's 38 states that nurse practitioners can practice independently in. We are board certified. It is a master's degree level. And when it comes to primary care, the world is your oyster, really, to have your own business. And but back then, it probably was very small scale, right? You didn't have as many people doing this, because now that the law has changed and we have more autonomy in more states, you're seeing nurse practitioners come in and really fill the gap of primary care and pediatrics too. So I'm going to say one other thing on that too. When I first started, I was the first nurse practitioner in Maryland to actually start an independent business. And at one point back in 2009, 10, 11, I'll never forget, I had called a doctor. I needed to talk to him about his patient, and he was a specialist, so he wasn't a primary care. And he actually refused to talk to me because he's like, no, nurse practitioners can't do that. He flat out refused. And I was like, well, can we just put that aside and put the patient first and have a conversation? So that has changed as well. People at one point were like, you can't do that. And I'm like, well, I'm going to do it and we'll see how this goes. I had doctors laugh at me. I had a doctor that told me that straight in my face that there's no way anyone is going to go to a nurse practitioner for medical care. And that has really love it. Because, tell me I can't do something, I'm going to turn around and prove you wrong. There's just the way I operate. So.
Thanks for sharing that, Kelly. May I ask, do you still run into that type of issue?
Not so much anymore. I think in the beginning it was like that. And I think now that I've been here for so long, and I think with the law changing and education and policy around nurse practitioners and what we can do, that has changed. And I think doctors have really gotten on board with the fact that they can't do it all, and they can't provide primary care services to so many people. I mean, we have a huge shortage of primary care doctors in this country, 98,000 roughly short of primary care doctors. And with an aging population, with the aging medical staff as well, a lot of people nowadays that go to medical school don't necessarily go because they want to be primary care doctors, right? They go because they want to be cardiothoracic surgeons or interventional radiologists, the careers that attract better hours and a lot more money.
I'm curious, kind of to your point, Kelly, about who's studying and who's going into nursing. On this call, how many of you are already in a nursing program? I guess is my first question. So how many of you are already in show of virtual hands? How many of you are in a nursing program? No one? And then how many of you are like pre-med or, on the med school path, virtual hands?
Okay. Yeah.
We got one hand. Okay, Sierra.
Are any of you
And
considering the nursing or pre-med field?
Awesome. Well, how about you all come off mute and share with us what exactly you want to do in the healthcare field? And that might help you think of some questions to ask Kelly. She's here to support you throughout your journey, and I think that she has some great insight for you all.
So for me, I want to either be a psychologist, psychiatric nurse, or LPN, just for starting out. Yeah, that was basically the answer to your question, right?
Yep. I want to say something to that. When I look back on, getting here, I'm an adult nurse practitioner. I really see geriatric patients. We see everybody 18 and older with our license, our board certification. And we have such a huge shortage of mental health providers in this country. I mean, you think we have a primary care shortage, our mental health is triple that. And access to them is almost impossible. There just not enough of them, and especially through a pandemic of how many people who have suffered in this country, the adolescents being one of the bigger groups. I'm telling you, go for it. And to go into mental health arena, I look back and I think if I were to do it all over again, not understanding what was going to happen in this country with the pandemic, I would become a psychiatric nurse practitioner. And you can go to nursing school, you can get your LPN, become an RN, become a psych MP, open your own practice, you can counsel, you can write prescriptions, which is a win-win. Lots of times we end up writing a lot of medications for sleep, anxiety, depression, and ADD. But we don't do the counseling piece as primary care nurse practitioners, where we send them out for like social work or counseling or psychologist, to go talk to. But the one thing that I think is really cool about the psych NP role is that they get to do all that. They counsel, they can have their own business, they can write prescriptions. It is really a huge and upcoming thing. And, University of Maryland has a big program there. We have actually a nurse that worked with me here, and she's in the program there to become a psych MP, and she's going to come back here and work for us. So there's just, the options are endless. I love the whole mental health arena because it's just an untapped area that needs quality people to work in it. So good for you.
I saw Race that has her hand raised. Did you want to say something?
Yes, can you hear me?
Mhm.
Hi, Kelly. Thank you so much for coming here today and sharing your experience.
Welcome.
Yeah, thank you. I'm currently getting ready to start PA school in few
Mm,
months.
yeah.
And I was wondering if you usually have PA student who shadow you as a preceptor,
Yeah.
and what kind of advice do you have for PA student?
Mhm. So, the only difference between physician assistant and nurse practitioner is probably training. And, nurse practitioners have to be master's prepared. I know most people that go to PA school get a master's, but there are some programs that are not, a master's, that require masters for PAs. So PAs operate under a physician's license, right? That's the difference. Where nurse practitioners get their own license, we get board certified, but we all do the same thing. We're all delivering the same level of healthcare. We're all allied healthcare members. I'm a huge support of I have so many PA friends. We support each other because we have a lot of the same rules and laws that work around us to practice medicine. And if you need a preceptorship, nurse practitioners can have PAs precept underneath them. I've had several that have come through here and spent clinical hours, training underneath me. So that's definitely an option if you ever need a site, because they're hard to come by. Maybe not so much now that COVID's over, but during COVID, we, finding a clinical preceptorship was really hard for a lot of students in programs. But yeah, you're going to learn a lot. You're going to have a great career ahead of you. And, if you love the operating room, if you like to be in the OR is a great place for PAs. They get really good training in their program for surgery. So it's exciting.
Thank you.
Yeah, you're welcome.
I noticed Sierra mentioned something in the chat, and then we can go on to Sakina. But Sierra did mention that she's going into her nursing program next semester, and
Mhm.
she's currently preparing for her ATITs. Her goal is to become a travel RN to prevent or decrease bias acts and increase compassionate care. So if you can talk a little bit on that, Kelly, that would be great.
Sure. I mean, about travel nursing, is that kind of where we're chatting about, or disparities in the healthcare profession? I mean, I would say this for Sarah, when you graduate nursing school, I mean, you're going to be able to go work anywhere, right? Your biggest, goal is probably going to be get into the hospital, get into a preceptor program in a hospital to get the hands-on experience you're going to need to go travel. Travel companies don't take nurses that don't have hospital experience, right? So, but you make a good living, you get to travel, you get to, name your place and you can go. You get a year's worth of experience under your belt, or 18 months working for a hospital that has a good precept, they all have good preceptorship programs that you come in and start off in an ICU or an ER, or even in med surge, where just your skill set just is like the foundation to becoming, just a superior nurse. And then from there, you can do whatever you want. I mean, isn't that, the need is just so huge. So I just love to see young people wanting to go into medicine and, to be nurses or PAs, doctors. I mean, it's great. It's a great time, and you'll always have a job. Always. So great.
Thank you, Kelly. Are you familiar with the ATI? If I'm mispronouncing it, please correct me, but the ATI-TEAS?
I'm not sure what that is. What's the long spelling of that? Like, it's short for.
I think Sierra would have to.
Yeah, I'm not sure what that is. We do, it was, I don't know if I had pre-testing getting into nursing school. We had the NCLEX exam after, you graduate, you had to take your NCLEX, but I didn't know, I'm not familiar with that.
We have Sakina has her hand up as well.
Hello. Sorry my camera's on.
Hi,
Every time
Sakina.
I turn it on, it just lags really, really badly. So hopefully next time. But I just graduated with my MPH in late 2022. And like a lot of what you've been talking about, whether it's people being underinsured, whether it's disparities, well, inequities is what I would call them, and like all of these other things are all kind of public health issues. So I was wondering, like, where do you see that fitting in? Because also with COVID, we see a higher disabled population due to the long-term COVID symptoms, and a lot more chronic illnesses when we see more people with asthma because of air pollution, you know, et cetera, et cetera. I could go on and on.
Yep.
So I was wondering, do you see public health playing a bigger role in like primary care practices now? Do you see it, like, do you think that that's kind of the direction that we're going in right now as a country or as a city? Let's not bring the whole country into it, but like as a, you know, DMV area, but based on your experience in the various hospital systems and your own practices.
Yep. You know, that's a really good question, because, you know, people get their primary care right now, you know, either in private sector, like private practice like mine, or they go to a hospital setting normally, right? And whether you have Medicaid or uninsured or insured, you're going to a standing facility. And I think public health has got to get involved on some level, because how are we going to take care of people who don't have access to healthcare, right? Depending on where you live, what you can afford or can't afford. I mean, and just for even routine, you know, vaccinations and getting, you know, and that reach out to the community to make people aware of what's happening in our DMV area. I mean, I think there's such a huge need for that, and just the awareness around it. You know, not only in DC. I mean, there are states that really suffer and where people live rurally and don't have, you know, access to healthcare, and that's where, you know, public health advocacy and setting up all these remote places and doing telehealth, which has never been bigger. I mean, we've been doing telehealth since 2012. You know, I used to do maybe one telehealth a week. Well, you know, COVID came and we were doing 150 telehealths a day, you know, so people could continue having access to us, getting them the resources they needed if they need to be swabbed or tested, or, you know, continuing their medication. I mean, it's just, it's such a big, you know, it's really such a global thing, and how much that needs to be a part of how we fix our healthcare system in this country.
Well, I have a question, Kelly.
Sure.
Knowing what you know now, what is one thing that you may have done differently in your career journey?
In my career training, well, I took the long road, that's for sure. I didn't graduate my undergrad till I was 26. You know, so it took me a long time to get to to get through my bachelor's program. You know, I had a few, you know, forks in the road that I had to hurdle over, you know, money being one of them. I had 3 siblings and there was 4 of us, and my dad made it very clear at a young age that he was not paying for 4 educations, that he couldn't do that. And, you know, so I had to work. I had to go, you know, I had several jobs, and so, you know, looking kind of back at that, what did I do different? You know, at one point you could have asked me that question. I really thought I wanted to be a surgeon, a general surgeon. I really wanted to operate, because I worked in the OR for a very long time. I just loved it. And, you know, I was like, oh, I should have went to medical school. I should have went to medical school. And this was before I was a nurse practitioner. That was probably, you know, I was on that kick for a while. And then you look at, you know, what it takes to go to medical school, 10 years, $500,000, and, you know, lots of call, which I didn't have to do as a nurse. But, you know, I think looking back, I think I'm right where I need to be. You know, I'm a thought leader in the industry. I want to show other people how to do this, and I'm glad I'm here. You know, because I have a lot of people that reach out to me who are trying to do this in other states or here. And, you know, how do you do it? All the hurdles that you have to go through. But I think if I could have a surgical piece to being a nurse practitioner, I would do that. That's just, I love sewing. I love, you know, putting a head back together when there's a big gouge in it, and that's one thing that I wish we were better trained in.
Kelly, Someone just sent me a question, so I'm just going to ask it for the
Sure.
group, but just wondering, do you have any advice or ideas of how people could go about obtaining shadowing positions? So I know you talked a little bit about the
Preceptor.
PA, the
Mhm.
preceptor, but what kinds of strategies might people use to find those shadowing opportunities?
But when you say shadow, are we talking like just to come in for a few hours one day, or are you thinking like a week? Because I mean, we have girls from high school that, or men and women that come from high school that'll come
Mhm.
over, and they have to fill so many like volunteer hours. So we bring them in, and they're interested in medicine. So we'll take them on. They'll work like 2 hours a week for like 6 weeks.
Yeah.
I mean, we're open to anything. You want to just come over and see how we do it here, like how we hump it every day and, move 200 people through this clinic. We could do that. You could also come on a Saturday and see us take care of all the sick people. We're open doors 8 to 1. Anybody
Mhm.
can come. We take care of, this, you can get your vaccine on that day. You need a prescription refill. You're sick.
Mhm.
You have a rash. We take care of all that. See everybody. And those days, you don't say this 5 hours we're open and we see about 30 people.
Wow.
So it's a busy, steady pace. But even if somebody was in, business healthcare and wanted to see like the other piece of this, the financial piece, how we run our EMR, how we send prescriptions, we're all electronic. We don't write prescriptions anymore. I mean, we are like, every day I feel like we're always evolving to something new. And what's the newest, latest and greatest? But I will leave, you can share my email with anyone.
Okay.
People can reach out to me. I'm happy to help you. I'm very well connected in this area too. So I could, if it wasn't me that could help you, I could probably find someone who is, who could help you. So yeah,
Great.
lots of
So-
opportunity.
So for the folks who are going to be here in the DMV, it sounds like you just opened the door and the invitation.
Yeah.
That's awesome. Thank you.
Yeah, if you're here and this is easy for you, I mean, we're right here in Bethesda, Maryland. We also have an office in Clarksville,
Mhm.
which is a little bit more towards Baltimore. And so, yeah. And if you're interested in dermatology, we have a whole skin, business as well,
Mhm.
where we're, taking off cancer, doing full skin checks. We also do some cosmetic stuff over there, which is kind of fun, but yeah.
Awesome. And Kelly, maybe this would be a good opportunity to talk a little bit about the internships at your practice this summer.
So we want to fill for sure 2, maybe 3 internships, 2 on the clinical side, with if you're in the nursing field or if you're thinking, pre-med, getting you in here, showing you how to room patients, taking an inboard, like a clinic, what we call like an intake of clinical, talking about medicines and the medical lingo, showing you how to do vital signs, how to take a blood pressure. And if you're really eager, we'll even show you how to draw blood, get you down to like, drawing routine blood work. And you have to start somewhere, right? I mean, you got to dive in, and you just have to have a good preceptor that is willing to teach you and to mentor you. I mean, we do them all day long. So there's plenty of patients. Our patients are great. They know that I'm really big into, mentoring, precepting, and they know if they're seeing me that I'm probably going to have a student with me or someone shadowing me. So yeah.
Great. And if you are interested in the internships on our side in terms of the details, we just need you to, and many of you have already applied for our internship program, and we're going to be hosting interviews, and then we'll be sharing with Kelly who we recommend as matches for those positions. So Kelly, while you just mentioned it, but can we drop your best email into, or can you drop your email into the chat so folks
Yep.
can, thank you.
And if I would say this too, I think we also talked to Victoria about possibly doing an internship for someone who maybe doesn't want to be in the clinical room, in the back, hands-on, but wants to see how operations go. Because I have a COO, she runs all my companies for me. She's incredible. Just with, the daily operations of all the little hiccups that come up every day, that she's either putting out fires or making sure things are working appropriately. that's a whole nother avenue. And I think we talked about possibly putting someone there too, if someone was interested in that, like the back end vaccines. So, yeah.
This is incredible, Kelly. Thank you so much for opening your doors and just being open with the students and sharing your experience. Scholars, do you have any more questions for her?
I do. And thank you, Kelly, for sharing that internship. I wish I had that when I was in undergrad. So I'm urging everyone, please take advantage of it. I currently work as a medical assistant at a FQHC here in Montgomery County. And sometimes when we triage patient, they ask us, okay, am I seeing a doctor, a nurse practitioner, or a PA? Now, as a future provider myself, how do you usually deal with that? If a patient only want to see a doctor, how do you try to convince them that you can provide the same care as the MD doctor?
Yep. Well, to start, usually they don't get back to see me, you know, unless the front desk has already had that conversation with them when they're making the appointment, you know, because lots of times they'll call me like, well, is there a doctor there? You know, do you have a doctor on site? And they're like, no, we don't have a doctor. We are a nurse practitioner owned, operated company. We only have nurse practitioners here. And then lots of times my front desk will encourage people, well, listen, make an appointment and come meet her, or come meet Sarah, one of our other nurse practitioners, and you just come in. Nobody's telling you to sign on a dotted line anywhere, but come in and just see how we do things. And usually that's all it takes. And then I'll have a conversation with the patient, because at least twice a day I'll get someone that says to me, so do I need an MD? Or, you know, what's the difference? You know, can you fill my prescriptions? There's a lot of educating going on, you know, back and forth with the patients, and just letting them know that, listen, we operate as your primary care. We can do everything a primary care doctor can do. And if you have a problem, just like your primary care doctor, we're going to refer you. And I always say, listen, if I can't find the answer for you, I will find someone who will. You know, a lot of this, you know, referrals, I've been doing this a long time. I know a lot of people. Somebody, you know, make a diagnosis of cancer. I can get them in within 2 days. They don't have to wait months to be seen, you know, the backup that happens. And, you know, it's kind of I really consider myself like a collaborator of care too, that connecting people, patients to doctors, the good people. So, you know, a lot of times too, I'll have patients leave here and be like, why did it take me so long to get here? You know, we just have a different vibe. You come in here, it's pretty and it's bright, and I don't want it to feel like a doctor's office. You know, people don't like going to the doctor. Right. And, you know, I hear that a lot too. And I'm like, listen, people are like, I love to come see Kelly. This is like, can I just stay? And I'm like, well, you could, but I think you need to leave. But I mean, you know, it's just a different way of delivering healthcare. And yeah, I think people get their head wrapped around it. They see the fact that you're competent. You've been doing this a long time. You help people. When people know that they can rely on you and you follow through on what you do, it's never an issue. It really isn't.
Thank you for that, Kelly. Can you touch a little more upon that in regards to how your practices have been able to remain so successful throughout the COVID pandemic these past 3 years, and what that has looked like for you all?
So, you know, COVID was, you know, it was a curveball, I think, for everybody. So we draw blood in our office. We send it out to LabCorp and Quest. So I don't know if anybody's ever noticed, you go to your doctor's office, they send you to LabCorp Quest to get your blood drawn. Does anybody? Anyway, so the fact that we all do it here, we're nurses, we draw blood. We draw all the blood, we run all the tests, we put all those tests in the EMR, we send it to LabCorp, it comes back. So just by chance, the fact that I was doing that already, when the pandemic hit, we had PCR swabs to swab people. We had 500 of them sitting in a box in my lab. And I was like, we shut down for about 4 hours on that Thursday and Friday. I had to call everybody back to work. And I said, okay, we have to make a decision. Are we going to stay open? And are we going to test? Because that's the next step here. Or we're going to furlough everybody and you're going to go home in telehealth. Everybody unanimously was like, we are staying open and we are going to test people. So we threw an email out to all of our patients, letting them all know that we have PCR swabs. And it went bananas from there. And then 2 weeks later, I was actually calling contract companies in Baltimore to get a remote, like a little unit to sit out in the parking lot so we could actually bring in the drive-through. We actually put a nurse out there full time. She swabbed people. We were swabbing 100 people a day for almost a year straight. Yeah. And in a mobile unit outside, we put it was on like little cement blocks. We had a heater in there. We had a remote lab in there, and we rotated who would go out there. And it really didn't affect, the COVID didn't affect us in a negative way financially. If anything, it literally was like dynamite to the practice. You know, you're the first one to swab. We were the first drive-through here in the very beginning. And then once people realize that, you know, word of mouth spreads, and then everybody's signing up to come here, you know, because people didn't know where to go. And, you know, it was a good solid year and a half of like, what's going to happen today at work, you know, because in the beginning it was swabbing, and then it was antibody testing, and then, you know, the vaccine's coming. I mean, it's just been one next step, and we've just took every one of those and just ran with it. So,
How did you navigate the vaccine conversation with your patients?
I'm still navigating that conversation, just so you know. You know, because you're going to have people who are vaccine averse, right? You can just try to educate people, you know, on a global scale of what vaccines look like. You know, for some reason, people, you know, when you're kind of told you have to be vaccinated to work somewhere, people don't like that. And people want to have their own right to say yes or no. It's their body. And I am always respectful. You know, I always try to give them the pros and cons of everything. But also, if you're someone who's high risk and you decide not to take the vaccine, to know that death could be in your future, right? And I had a patient who that happened to, 38-year-old Hispanic male who really did not want to be vaccinated, but he had horrible asthma. I mean, really, and I was like, listen, you really need this vaccine. I wouldn't push it on you if I didn't think you really needed it. He refused to get it. 6 months later, he got COVID. He was in the intensive care unit, intubated for 48 days. He's alive. I mean, but he's got PTSD, you know, he's struggling, and he's got long COVID. So, you know, it's a conversation that you have to take time. You have to be respectful because everybody thinks differently than you. And I do respect the fact that people maybe just want to get it and not be vaccinated. And that's okay too, but it's okay for the person who's not at high risk, you know, who's really high risk and could get this and really cost them their life. Like, let them really think about that and what that could do to them and their family.
You bring up a great point. Thank you for that.
Mm-hmm.
I'm wondering, I think we're moving towards wrapping up, but I'm wondering if we can end, could you share, oh, well, first, I just want to see, does anyone else have any questions? Any questions or thoughts? I'm staring into the people without their videos on. I'm like, Betty, no. So my question, I guess, you have been in this business for a while. I know you've shared about the ways that your work has grown and changed through the years. Can you just share, just to end us up, you know, with something inspiring, and I just am wondering if you could share, you know, what keeps you going and what continues to inspire you to come back and keep moving and evolving and changing? Like, what is it that keeps you coming back to this work?
Well, I'll start off with this. You know, when I started my practice in 2009, I had this many patients, 0, 0, 0, right? And I had to go out and ask for the business, pound the pavement. I went to the emergency department, and I look at what I've grown. And the thing that inspires me the most is the fact that the people I used to work with at Sibley and all the people that knew me, they trusted me, and they send their patients to me today like they did last year. And I think every day I wake up and I get to come here and change a life. I mean, in a world where humanity really no longer exists. I mean, I feel like sometimes everything we read, another killing, and these young kids are hijacking cars in DC and they're shooting people. And I'm like, okay, what happened to taking care of each other and being neighborly and loving one another and giving the best healthcare possible? You know, and 70% of my job, it's listening. I'm not shoving pills down people's throat. A lot of people just come in because they need someone to listen to them and tell them it's going to be okay. And I'm here with you along this journey. We're going to do it together. So to be able to be that for just one person is motivating enough for me, to wake up. And yeah, it comes with headaches, and it comes with hiccups, and it comes with sleepless nights and sad days, when you're diagnosing cancer and you're delivering that information to someone. It's hard, but I'd rather that be me in the room because I care about that person than someone who doesn't.
Awesome. Thank you so much for that. If there are no more questions from scholars at this time, I think this is a good place to end. This is not goodbye forever. You will have Kelly's email, and you can always reach the Economic Club if you need to get in touch with her. So please utilize her. She's a phenomenal resource. Thank you so much, Kelly, for taking time out of your day to speak with our scholars.
No, you're welcome. Thank you for having me. It's been fun, and I'm honored. And please use my email. I am here. So to help.
And Kelly, we're just going to ask that you stay on. We have a student who wants to speak to you after this.
Sure.
Thanks everyone for coming.
Thank you.
Thank you.